is dysautonomia? What does that mean?
Okay. Great place to start because one, it's like a weird word. So
Yeah.
that always gets you tripped up. So if you just kind of start from the word part, your autonomic system, and most of you guys probably know if you've been following Amy and kind of keeping up with her work. But the autonomic system is just part of the way our brain works. So we have a central autonomic network, and then we've got a peripheral component. So like the central part is the computer part, and then you've got a peripheral system. And that's what we usually think about when you hear words like sympathetic and parasympathetic systems and that fight or flight or rest and digest. That's really the peripheral part once it's exited the brain. But the central autonomic nervous system is kind of the computer part inside the brain. So when we have different levels of TBI, whether it's, a concussion or even something like a whiplash in a car accident, all the way up to like severe TBI, we have the probability of damaging the pathways that are actually under autonomic control in the brain. So what does that mean? Like, what happens would be what we feel in dysautonomia, where that autonomic system kind of starts to go a little haywire. So we might notice that as like, we're not able to control the speed of our heart as well. We're not able to regulate our blood pressure as well. You might notice it in your pupils where you'll see, one pupil is bigger than the other, or they don't react the normal way. You might notice that your temperature regulation is different, or like you sweat a whole bunch or you don't sweat at all. Yep. You might notice even in your digestion, becoming gastroparetic. I think a lot of people experience after a head injury where all of a sudden, like, you just can't tolerate eating certain foods for a little while again, and your digestion's a little weird and things don't quite work the same. Sometimes people even get sensitive to different foods. So all these things that just run in the background of our life that we don't have to think about, that we don't control volitionally, our breathing, our heart rate, pupils, skin, all that stuff, that's all controlled by your autonomic system. So if we have those injuries in the brain, it can impact how that whole thing works, which is a bummer because it's usually not comfortable types of symptoms. And a lot of times they just kind of get, left out of the mix.